Hi, my name is Amy Strudwick, and I'm a registered psychiatric nurse. For 14 years, I worked the front lines in acute care at both the Regina General and Pasco hospitals. I left the bedside to work in healthcare quality improvement in 2012, when the province implemented Lean as a means to transform Saskatchewan healthcare. I could no longer stand by and do nothing while our system was in crisis. This was not the legacy that I wanted to leave for my children. I will soon become a certified Lean leader in the Regina Qu'Appelle Health Region, and I'm honored to have been trained by the world-class John Black and Associates. As a frontline worker, I was painfully aware that every single day, patients were being harmed while in our care. Patients receive the wrong medications, they fall, they get hospital-acquired infections like C. diff, VRE, MRSA, they get bed sores, they go septic, and they are exposed to unnecessary testing. These are just a handful of examples of patient harm that I see take place that are 100% preventable. Although we saw patients harmed every day, it wasn't acceptable for us to talk about it. Providers were allowed to become complacent. Most of the time, patients weren't even told that they were the unlucky recipient of an unintentional medical error and that our system had failed them. I watched the quality of patient care steadily decline and witnessed the birth of a provider-centered culture. I saw a marked change in the values and philosophies of care providers from what I was exposed to in my early years in nursing compared to my time spent as a senior nurse. For too long, I've been part of a system that has allowed providers to lose focus on the basic fundamentals of their profession. A system that has become riddled with wasteful practices and inefficiencies, and a system in which there is very little focus on patient and family-centered care. Lean methodology teaches us to be transparent in order to learn from our mistakes, and that 0 patient adverse events is the only acceptable number. Lean pushes us out of our comfort zone. Lean is about no longer tolerating complacency. It gives us the tools that help us create a system that delivers safer, better quality care. And the bottom line is that safer care is cheaper care, and that's how Lean lends itself to cost savings. Lean methodology challenges every person in the system to work differently, to think creatively, to work cross-functionally, and most importantly, to engage patients and families at every level of decision-making throughout the organization. As a nurse, I fully support the implementation of Lean in Saskatchewan healthcare, and I am extremely proud to be on this journey with the province. We have a very long road ahead of us, and it's going to be bumpy, but we can't confuse our path with our destination. Lean in healthcare works, but it takes a long time and many small point improvements to see large-scale success. No one said Lean implementation is quick or easy, but I believe it is absolutely the right thing to do. It's better to do something imperfectly than to do nothing flawlessly, and I applaud the province for bringing Lean to us and to our RQHR senior leaders for supporting it with the enthusiasm that they do.